Maryngotomy with cold knife. C. Maryngotomy with ventilation tube insertion. D. Maryngotomy with diode laser. The correct answer is C. Maryngotomy with ventilation tube insertion. Glue ear includes thick secretions that accumulates in the middle ear. Option B and D include only maryngotomy, which would later lead to recurrence of the disease. The right option is C, that is maryngotomy with a ventilation tube insertion, maryngotomy drainage, and long-term aeration of insertion with a grommet. Which of the following is true regarding facial nerve palsy associated with temporal bone fracture? A. Common with longitudinal fracture. B. Common with transverse fracture. C. Always associated with CSF otorrhea. D. Facial nerve injury is always complete. The correct answer is B. Common with transverse fracture. Palsy is not always due to transection of nerve. It can occur due to intraneural hematoma or spicule of bone embedded in the nerve. Facial nerve palsy occurs in 50% of transverse and longitudinal and 20% of longitudinal fractures. The posterior superior reaction pocket, if allowed to progress, will lead to A. Sensorineural hearing loss. B. Secondary cholesteatoma. C. Tympanosclerosis. D. Tertiary cholesteatoma. The correct answer is D. Secondary cholesteatoma. Option B should have been primary, not secondary cholesteatoma, and there is no such thing as option D, that is tertiary cholesteatoma. Secondary cholesteatoma occurs due to migration of squamous epithelium through pre-existing perforation, such as posterior superior marginal or total perforation.